Okay, well, this would be Stockwood 4, I think. So there aren't that many slides left. God. So I think this slide is just to show how things sometimes are best left alone. So the picture in the middle, I'm not sure when that was taken, but it hadn't changed much. And I remember the guy coming in as a new patient, and you can see there's hardly anything left of the tooth in 2008. And well, it still isn't in 2017. Probably a lot more than if I'd done what I was going to do, which was to try and put in a bonded amalgam core, because we were doing bonded amalgams then. So I'd have put some little grooves within the dentine and used, I think we were using Panavia to bond in the amalgam. And then on top of that core, I'd have done a crown. Anyway, he wasn't keen. It's been like that for years, he said. It's not doing me any harm. So I didn't do anything. It's still there. I'm sure it's functional to some degree. Not so good on the lower left. Yeah. So, logically, you think, should I take out the 7? I didn't want to do that. The, endodontically treated teeth are very brittle, and he wouldn't thank me. So I did say, well, you can see how the roots erupted, and if he gets food stuck, then that could be a potential problem. Reality is, if you got food stuck, you just smooth it down a bit and let it fall out as you would if they were 90. He wasn't 90. Oh, it looks like I saw him in 97 from the notes. So yeah, that tooth there, yeah, that's 20 years, isn't it? Yeah, definitely better off without me touching him. So we can leave things, and we just need to look back at the x-rays, which is far easier to do now than it was when you just had them on little bits of paper. Well, not little bits of paper, but in the little paper sachets, and then they all faded. So the other part would be that if we had AI, that would interpret these in such a manner that we could decide when we need to do stuff and intervene and when not to, and what works and what doesn't. So really, with machine learning, if people are prepared to let us use their data, which is just their X-ray data, we'd all benefit. Probably have to do about 4 or 5 consent forms and get insurance, but we could help one another. So I think this is, yeah, I mean, what on earth is going on here? So I'm looking myself. But yeah, I never took this tooth out. Like it wasn't given any harm. Clearly it moved around, but she maintained it was functional. And she didn't want to have a denture. She didn't want to have an implant. Why should she have anything else done? She wasn't in any pain. And so, this isn't a good example by any stretch. I don't know what's holding the tooth in. I did hemisect quite a few teeth. Yeah, but I did when I hemisected them, I had root fill them first. One of the few times I referred to a periodontist, and there's a big story for that, but this one was terrible at cleaning her teeth, but she'd sued the previous dentist. So, she wouldn't clean her mouth. So I referred her to the perio, and this tooth was in the breeze, and he wanted me to hemisect it. Didn't mention root filling it. So I said, I couldn't see it. She saw someone else. And so this one, yeah, it's along those lines, is that, so this patient, she had a sinus on the bridge, retainer of the bridge, even though the root filling, I could have tried to do it again, but I wouldn't have improved on it. And so I sectioned the bridge and left it as a direct cantilever. And again, this worked pretty well. And so the pictures aren't great, but then she wasn't happy with the space. She didn't want a denture. And so I did well, as you can see, it was a Maryland or acid etch retained tooth. I didn't do them, I think I may have done one. It was zirconia. Because these others have worked so well, these were the metal wing. I did loads of these. I think the most I did in one patient was 5. And yeah, if they look after themselves, They last, well, some have lasted 30 years. Actually, one had lasted 40 years. So they last. So what's this one? Yeah, this one. It's a, yeah, so you can see at the bottom right, it's the bit of tooth is opposing a bridge, and it's so it's functional to a degree. At some stage, I tried to crown it, so that gives you an idea. So you can see that's a CEREC prep on top, upper right. And by you can see the bottom left, it hadn't worked. The area on the mesial root hasn't changed in 11 years. And it was still there when I left. To be honest, it doesn't look great, but it's functional. When I say functional, it may not be an occlusion, but it'll get some function out of it. And yeah, I didn't do the bridge. In fact, I didn't do any of this apart from try and put a crown in, and that is one that clearly failed. Yeah, you can see from the, it looks like I had a second go. You can see from the prep in the lower left, that's one of my CERECs trying to, yeah, do pinned retained cores. So I think these are just some notes, some things to talk about when we did peer review. And so you can see there isn't much of the tooth left, but you probably saw this one on a previous slide. And oops, so that's what I did do is if they lost a cusp, I'd always just put a bit of glass ionomer in, and they often lasted a long time. I'd say to my patients, you know, like certainly this one, look, when it fails, book yourself in for an hour and a quarter, because then I'll do the crown and I'll have a coffee break and you'll be quite chilled. Anyway, it took a while till I did it, because often the patients didn't ring up and say the side's fallen off, I need a crown, book me in. They turn up for the checkup and say, look, the sides fell off again, but I really don't want a crown. Can you not just glue a little bit back in? And you know, so they haven't lost anything. Yeah, so I use the glass ionomer a lot. Now I'm not sure if this one's going to talk, but I'll let her start. If she is she going to talk? Oh yeah.
Hi, this is Dr. Feng Hui Chen speaking. Today I want to talk about use ozone therapy as an alternative to.
Let's see if you get to the end. I mean, she just talks nonsense.
To do 4 weekly session, I usually can have a 90% of success rate to reverse the root canal treatment. Besides this, I also incorporate that homeopathy remedy.
Yeah, well, what she's saying is that instead of putting the ozone down the root canal, and I had some a way of adapting the cup on the ozone machine, the way it was a silicone cup, sit over the root and apply ozone down the canal. It never worked it out. But what she's talking about is holding the ozone cup against the skin on the outside of the jaw. And you're thinking, really? You know, she just anyway, just because he didn't have any symptoms didn't mean that the tooth's still not infected. It just goes to show that you know, during COVID, when we had AAA antibiotics, analgesics, and advice, how many of those patients come back? The ones that come back and have an extraction or a root filling are probably doing worse than the people who had nothing done, as you could see from the previous x-rays. So if we can spend 30 billion on track and trace, which I think was a bit of a failure, couldn't we just spend a little bit to look what's happened to these people? There may well be other options available. I mean, not for everybody, but not everybody who's got a non-vital tooth comes through the door in pain. Oh, I don't know what's here. Oh, yeah. So yeah, I think this was just some awful stuff on the on YouTube. So these were from, you know, years ago, and I won't play this. I don't know if it does. I don't think it does play. Oh, let's have a look. No, it didn't play. So I'll come back up again. What it was a chap showing how to do yeah, the whole thing, I think he saw was about half an hour long, was root canal therapy in deciduous anterior teeth that were prepped for post crowns. So clearly the child must be about 4, having a GA for a couple of hours. I think if they had the name on it, he has got his name on it. That's almost murder. Mad. Standard operating procedure. Yeah, I've forgotten about that. So one of the things was, that could well be one of my packs of notes from years ago. So that's how I used to keep notes in a filing card, and you put inserts in the card. So the story behind this is, in the practice, and this was even after computers, I think, to a degree, we just noted in the card that we'd put computer notes. But there's a limit to how many cards you can fit in. And again, you've got your age graphs, and actually it looks like they've got what was called a DC, FP17 DC. I can't remember what the DC standard for, but basically it was to give the patient an idea of the treatment that they required. So at the practice, we run out of inserts. So I ended up having to go to the office where they kept all the NHS paperwork, the cards, the inserts. They also kept the DCs there. So these forms that you're meant to give to every patient if you're going to do any treatment, I think they changed it to treatment over £50. And so I turned up and said, look, we need these inserts. And then I said, oh, you got a load of DCs there, FP17 DCs. I said, how frequently do you get through them? And he said, well, no one's ever asked for them. Now, either, so the inference is, you might get into trouble because a patient complains and they didn't get their DC. It's even worse now. And one of the things is, because we got computers, we write note after note after note because it was never ending. If you'd just seen some of my notes before, you wrote as little as possible because the last thing you wanted was to take up room on the card. And that's why you had, I had exam, S&P, NAD, TC. Exam, I think you worked that one out. Nothing abnormal discovered. S&P, scale and polish. Can't say that now. Treatment complete. And then hopefully it had a note saying that they paid whatever it was, £10.50, £8. Right, so this lady came in, right? So actually, yeah, it is her. She's got more teeth than I thought. But so the reason this has probably worked is opposing these lower anteriors is a denture, right? This woman smoked like a trooper. So I can remember her voice now. Anyway, so awful oral hygiene for 30 years. And she came in because the lower right central had wobbled out. I said, right, I'm sorry, it's got to go. And to be honest, when they go, these lower anteriors, they tend to all go. I said, so your best bet is to have the loose ones taken out. And she said, oh, I don't want a lower denture, Mr. Smith. I really don't want a lower denture. So I says, I tell you what, I'll try and glue it in. And so that's what you can see. I glued it in with a bit of composite. As you can see, it's pristine there, as is the before I even did the scale. I did scale her teeth. I didn't go wild. You wouldn't. So anyway, so that must be, yeah, that's present, as it said there, for over 16 years. And, so it's definitely 20 years. Anyway, a few years later, she lost the lower left one, just exfoliated out, And so I stuck it back in. It should work last time. So, section the tooth, composite, just glued it back on. I tended to cut a little groove in the remaining bit of tooth. Anyway, she came in one day and she'd lost it. So she's lost the tooth. So I had nothing to stick in. And I said, oh, we better take the teeth out. Oh, no, Mr. Smith, please. So you can see what I did. I said, well, don't tell anyone. It'll be our secret. I'll do this. And that's what I did. And as you can see, it doesn't really pick up the correct amount of staining. And she really tried hard with her smoking. And oh, got the dates there. It was, but yeah, it worked. It worked for a long time, and far better than a denture. So everyone's a winner. I think this is an odd one. The guy come in, fell off his bike, so I think this is probably the last one. I couldn't see anything wrong. He said it was really sore. Yeah, and so when you give it a bit of a wiggle, you could see there's a crack. So I've been on a course with canker, and I thought, well, it might be quite clean. And it was, so canker, I think, is related to Optident, not related, but was his business, I think. And so he spoke about doing vital bonding. And so I just applied, I etched and bonded that. And so you can see the line. I'm not sure when the dates were. Yeah, so the picture on the lower right was a couple of years later, but he still wasn't in any pain from it. But clearly he'd also had a fracture. It was palatal, it's a weird fracture, but the tooth was still there, and I don't know if it got another x-ray. Yeah, so I really wasn't keen on doing radiographs or doing root fillings on teeth where I couldn't see any apical involvement, and I still can't see there. Didn't discolor apart from the platal aspect, and that's probably some bleeding from the palatal gingiva, who knows. So yeah, I don't know what happened to him, but I never did anything else. And yeah, I think this is the last slide, but what I'm saying is the whole technique, I'm not sure if it says anything about that, but the story goes is that Mrs. Hall, when she made the crowns, I think she'd missed on the initial, the first way they were done by reducing the tooth and giving local and stuff. She just popped them on and got the child to bite together. And of course, after a while, they sort of bedded in, as you would say. After a while, lots of bonded crowns I made that, he'd say to the patient, so it's a little bit high, and he'd say, oh, it'll bed in. And, they did. They never really broke. It was very rare. I mean, there's a limit, and, clearly adjusted quite a few of them. But, sometimes things work, and they work despite any great evidence. So this huge technique was basically because she had the evidence that they worked, even though, and I may be doing her a huge misjustice, as you'd say, in that she knew what she was doing. But it certainly wasn't the way that I was taught to do them. But the doll principle that we use in UK, but apparently I don't know, maybe they do now, but they don't agree with it in the States. That's based on one case of someone with a chrome. I did read somewhere else that was based on 5, and I think his name was Mr. Dahl. But that again was sort of an outlier. And the kind of the message is perhaps we need to just think a little bit more for ourselves rather than, and try out what works. I think for myself, I always try to do as little as possible. So that would be minimal invasive dentistry, which is not the same as supervised neglect, which was a term that went around a lot with planned patients. And I hope you think about what you're doing and why you're doing it, and is there an alternative? And if you have a mistake that suddenly works well, a little bit like the Maryland bridges only being one wing, which I worked that out about over 30 years ago. And we can all benefit. What's that, the last one? Yeah. Anyway, I hope you found these useful. I mean, the idea is just to think a little bit different. And certainly if you're an FD, and as often the case, you run out of things to say in the last 3 months, have a look at these and see if you agree with them and disagree with them. Yeah, and I hope you found them useful.